Hi guys, welcome to my channel. This is Dr. K. Welcome again to the Gynae Talks. If you haven't yet subscribed to this channel, karibuni sana. Just click that button down below because for sure you're gonna learn so much on reproductive health. And by the way, it's not fixed to only ladies, it's also for the gentlemen who want to learn a little bit about their ladies and want to understand what they go through. So today I'm gonna talk about vulval itching. That itch down there that's just not going away. That's the one we're talking about today. Karibuni. You know that time when you've had an issue down there and it's a little bit itchy, or there are these people who have this constant itch and it has been constantly there and it's just not going away. Really, I get you guys, I get you, because I've had several patients with the same issue, and sometimes a vulval itch or vaginal itch that's just not going away can be embarrassing, can be very painful because you end up scratching yourself, you can get infections, and worse still, it can lead to depression because you wonder what is wrong with you. And an itch down there is one of the most horrendous feelings that anybody can ever get. So let's talk about what are the causes of vulval itch, how it can be treated, and what are the complications, and and whether it's normal to have it once in a while. Good. So if you're still passing by the way, to this channel, please make sure to subscribe, and if you're not, just send it to other people so that they can learn just a little bit about vulval itch, and I will break it down into smaller understandable points. Good. So I'll start with the first thing the most common thing that can cause a vulval itch, and usually it could be something in your bathroom, and that is the thing that you use to wash yourself down there. Is it an antibacterial soap? Is it something that is harsh and it's irritant? Have you changed your soap? Have you changed your shower gel? Something in your bathroom could be causing you to have a vulval itch. So try and remember and check in your bathroom whether there's anything you've changed. It could even be a hair product that you use to wash your hair and it maybe trickled down, or it could be your shower gel. Maybe it's not microbiome sensitive, or you're using a soap that's antibacterial. It might be the reason why you're having an irritation down there. So check what's in your bathroom. It could be some irritant in your bathroom. The second one, and I'll talk about the most common things before we go into actual pathological problems, and it could be your underwear, the one you wear every morning, and if you sleep with underwear at night. If you're too sweaty, if you're not getting a very good absorbable panty, it might cause you to have some irritation down there. And then there's some chemicals. When, let's say, you have bought a new underwear and you don't wash it, that chemical can cause a lot of irritation, so you might want to check what's in your underwear. Or if you wash it in the machine, or you use it any softener, you might want to check, because that could be the reason why you're having a bit of an itch down there. So check on those two main things. Another thing that could be causing a lot of problems is what you wear on a daily basis. If you're a person who likes to wear synthetic trousers or leather trousers, leather skirts, things that are really tight, bikers, if you do that, you might have a problem with the absorbency, and that can also cause a lot of irritation. Some materials of some clothes can cause that, so you might want to check whether you bought a new something that could be causing that irritation, because most of the time if you have an itch, it means it's an allergic reaction to something around your environment that could be causing that vaginal itch. Okay, so I move now into other things that cause the itch that are infectious, like infections like Candida infection, which is very, very common in women. Anyone can get it, even when it is before their first sexual debut. That means even teenagers can develop Candida. Candida is a fungal infection. It can happen at any point in a woman's life, and it can occur even depending on your cycle, your period cycle. That's when you can get a bit of an itch before your period comes, or it can come really after. So you might want to check with your doctor if you're having a discharge that's suspected of Candida. I've done a video on the same, on vaginal discharge. If it looks like Candida, then you might want to get yourself checked. There'll be a test that will be done that will cause that will help us check whether it is Candida or not. So Candida is one of the most common. It's not a sexually transmitted infection, but it can cause a bit of itching. Okay, so another thing that can cause you to have a lot of itching is an STI. Some of them might cause a bit of itching down there, but they're always, not always, but can be associated with vaginal discharge. So if you're having that and it's not the characteristic of Candida, it could be another different sexually transmitted infection. You'll find that anyone who's sexually active and you are having vigorous intercourse, or you're having any kind of vigorous activity, you might develop cuts and bruises that can cause itchiness down there. So you might want to check with your partner whether you're being careful during this time. So you be careful, just use lubricant if you really need to, especially if you have dryness. Yeah, I said yes, use lubricant, preferably water-based lubricants. Yeah, be liberal with it. Okay, so those are the infections that are most likely gonna cause you to have a bit of itchiness, but there are other things that can cause you to be itchy. If you're dry down there, just generally any rubbing friction can cause small cuts, and you can get itchiness, and it's very uncomfortable for people who are dry. And this happens to people who are postmenopausal, because these guys, the estrogen levels are down, and therefore without estrogen you will have dryness, and that happens if you're postmenopausal. So if you are in this age group, you might want to check in with your doctor. Sometimes we give you some treatment for menopause. We can either give you some estrogen cream, or depending on how your estrogen levels are, we may just tell you to use lubricant at any one point when you have any dryness. Sometimes dryness, we also tell you to use an emollient, but you must have a doctor look at you first before you prescribe any emollients to yourself. Yes, so this itching is very irritating, and we'll find it mostly in older age group of women. Yeah, so these are the things that can cause you to have itchiness. There are other conditions like psoriasis. There's also there are several things that can cause a lot of itching, which you might want to check with your doctor, and sometimes dermatologists might have a look at you and might diagnose you with several things. So those can happen as well. So I will not go into the details of different conditions, but there's an important thing that I want you to note. If you have a consistent chronic vaginal itch that's not going away, you might have to have a biopsy done on that part of the skin, because it could be some worms. Sometimes, yeah, there's some worms that cause that, or the other thing is any neoplasia that can develop because it's developing where you're itching. Okay, so yes, there are people who have developed vulval cancer, but they have a history of chronic vaginal itch. So be careful about that. So make sure that you see a doctor, but first check what other things that could be causing you to have that vaginal itch. For the treatment, an itch is very irritating, so most people want the itch to go away. So there's something called the itch scratch cycle, and that is when the itch comes, you itch it, and then you feel itchy, and then you scratch. And then when you scratch, it becomes more itchy. Then you scratch, then it becomes more itchy, and then it becomes a cycle. And it can really cause devastating effects mentally and physically, because you're itching and it's not going away. It's very irritating, can put people in depression, anxiety as well. And this itch can cause injuries like scars and wounds that get infected. So you might want to keep your nails very short if you have this problem. We might give you an antihistamine to reduce that. If we've confirmed that you have Candida, we will treat the Candida. If there's an STI, we will also treat the STI. That's why I say make a gynecologist your friend. For the emollients, some of them we might be able to tell you to put them in the fridge, and then when you're feeling the itchiness, so that you don't itch that area, take that cream and just apply on that area that's itching, but don't scratch, because if you do scratch, you get more itchy feeling, and you scratch more, and it becomes a cycle, and that cycle is what we want to break. if the doctor sees that there's something wrong, maybe you're developing something else, they might do a biopsy on you, and if at least we get something early, if it's not a cancer or even cancers, we are able to remove them on time. So this is about vulval itch or scratch. So if you have any of these, please make sure you share this, by the way, because people keep quiet about such things because they feel like it's embarrassing, but no, it's not embarrassing to us. So bring them on, we will be able to treat you. I hope you have subscribed to this. If it has helped you, please comment down below. My name is Dr. K, and welcome again and again.